When we think about mental health care, we picture hospitals, therapists, clinics, but all in cities. What about the people who live 6 hours from the nearest psychiatrist? What about the 78% of Nepal that the system has never reached? This is Saveika, a mental health screening tool built for Nepal's 52,000 female community health volunteers. Every ward, one tool. Nepal has 3.9 million people living with mental disorders. Yet, there are only 0.22 psychiatrists per 100,000 people, nearly 6 times below the global average. Over 90% of those who need care never receive it. Meet Sita. She's 34 from Karnali province. She's been showing signs of depression for months. Her FCHV visits every month but arrives with no tool to act. Sita is one of 3.9 million. Rural Nepal is where the crisis lives and where the system completely breaks down. Mental health services are locked in Kathmandu. Stigma keeps families silent. Traditional healers are the first and only point of contact. But Nepal has something powerful already in place. 52,000 female community health volunteers, one per ward, trusted by their communities, already visiting every household every single month. 938 of them are trained in WHO MHGAP modules. Saveika gives them a structured tool to act on what they already observe. Initially, Saveika is a 12-question observational screening tool. The FCHV doesn't ask the patient to self-report. She rates behavioral signals she directly observes during a home visit. No clinical training required. It takes just 3 minutes. The system then generates a weighted risk score and produces a personalized specialist referral, with WHO MHGAP care steps included. The system runs in 5 layers. The FCHV inputs data. A risk scoring engine always runs. It cannot be skipped. A hard-coded safety layer ensures that any sign of suicidality immediately triggers a critical flag. No AI can override this. Then an LLM generates a plain language explanation in both Nepali and English. Finally, the output routes the patient to exactly the right care. Here's how it flows end to end. The FCHV visits the household monthly and fills the 12-question form offline. No internet needed. When Wi-Fi is available, it syncs through her phone. The system calculates the risk score, generates a Nepali language explanation, and flags the case if the score crosses the threshold, triggering a referral to the nearest health station. At the station, a risk-prone household member undergoes an extended real-time evaluation with our model. The model then outputs a condition diagnosis, specialist routing, Nepali recommendations, and an urgency flag. This same data can be provided to the organizations that are willing to help the risk-prone people. If critical, an alert is fired, and the appropriate medical personnel are dispatched, a psychiatrist, counselor, or addiction specialist, depending on the case. Under the hood, a Next.js and TypeScript front-end, Node.js backend, Supabase PostGRE SQL database, Gemini API for AI interpretation, and Leaflet and OpenStreetMap for geographic routing is used. Every single output is personalized. Children get neurodevelopmental pathways, older adults get neurocognitive screening, female patients with PTSD are routed to female specialists to reduce stigma barriers, women aged 13 to 49 presenting with depression trigger a perinatal pathway check. And suicide or self-harm are always critical, no exceptions. Saveika is free for every FCHV, zero barrier to adoption. Revenue is anchored in government. District-level lump sum contracts with Nepal's Ministry of Health, co-funded by WHO Nepal and INGOs like MSF and Save the Children. The roadmap is 4 stages. Pilot in one district with 50 FCHVs, validate outcomes, pitch MOHP for district contracts, then scale nationally. 52 volunteers, 77 districts, fully integrated. And this is the team behind Saveika. Thank you very much.